Hello, welcome back to my practice. My name is Lori Raffetto, MA, and I thought that today we'd talk about a disorder that is bandied about a lot in television and movies, and it's kind of a misunderstood disorder, and it's Obsessive Compulsive Disorder, or OCD as it's commonly known. Let's start by looking at those terms and kind of getting a better idea about what OCD is. The O part of OCD is obsession, and basically what obsessions are is they are thoughts or impulses or images that appear in your mind intrusively. They're unwanted and they really cause you some anxiety or distress. What makes them obsessive is that, as I said, they're unwanted and they seem to return again and again and again. No matter how much you try to kind of, repress them or push them down, they pop up again. That is an obsession. So in response to these obsessions, a person with OCD will create compulsions, which are behavioral attempts to neutralize the concern caused by the obsession, the obsessive thought or image or impulse, and kind of put them back on an even keel. But it becomes compulsive because you have to do it repetitively and it doesn't really work. The other hallmark of a compulsion is that it tends to go well beyond what would be required to actually neutralize the danger of the obsession in the real world. So let me just give you an example. Let's say that as a sufferer of OCD, you are very obsessively concerned about germs. It's a pretty common obsession. So you might use the toilet and then be very reluctant to flush the toilet. So you might get toilet paper and put a barrier between you or the handle. You might use your foot. That's common in public restrooms among sufferers of OCD. You might not flush at all and just be reluctant to touch. Then you might be concerned, oh, my hands, I could have H1N1, I could have strep, I could even have HIV. So you wash your hands for 15 minutes to eliminate any chance that there's any bacteria or viruses on your hand. That is probably more than the ordinary person would need or require to actually keep themselves safe from the danger of germs or viruses. It's natural to be concerned about those things when you flush the toilet or touch a computer keyboard or a doorknob. And so ordinary people every day do wash their hands after that as a course of safety. Where it becomes a disorder, and that's the third part of this, is that it does become time consuming. It takes up more than an hour of your day, and that you, as the sufferer of OCD, recognize that it is not within the range of what you would consider normal, So it would be something that is causing you distress, having a negative effect on your life. You kind of make the call and are aware of the fact that this is a disorder. Now, it's important to recognize that some other conditions can cause OCD-like symptoms. PTSD, for example, causes intrusive thoughts and sometimes avoidant behaviors as a compulsion to avoid the intrusive thoughts. So it's good to involve a professional to kind of make a differential diagnosis and kind of help you choose a treatment path that would be best for you. Also, it's important to recognize that this obsessive-compulsive cycle can be the result of things like drugs, both prescription and recreational, illnesses, fever. Medical conditions or physiological conditions can temporarily induce an obsessive-compulsive kind of behavior. So that's basically what obsessive-compulsive disorder is: obsessions, compulsions, and the disorder that it causes in your life. In our next video, we'll talk about what OCD isn't, as represented in the media, and we'll go on to a third video that talks about what you can do in terms of treatment. So thank you for joining me, and I'll see you again here on my YouTube channel.